It's my great pleasure to introduce Dr. Dana Newcomb from Children's Health Queensland. Dana is the Medical Director for Integrated Care for the organisation. And Dana's presentation today is going to talk with us and hopefully take us through a bit of a journey around the organisation's journey to become a Project ECHO Superhub. Dana.
Thanks, Frank. Hi, everyone. Frank, do you remember it was 2 years ago at APIC2 in Brisbane that the founder of Project ECHO, Sanjeev Arora from New Mexico, came to talk to us about the model, and CHQ was then a fairly new adopter of the model. So in just 2 years, things have moved pretty rapidly, and I'm pleased to be back this afternoon to update you. And as Frank said, I'll share our progress to becoming Australia's first ECHO Superhub and let you know how you and your organisations can become part of this movement. So what is it? ECHO is a hub and spoke model of education and support. At the hub is an interprofessional panel of content experts, and at the spokes are professionals working in community settings that don't typically have access to that specialist expertise. ECHO's largely been used in the health sector to reduce disparities and improve access to specialist care in rural, remote and underserved areas. But increasingly the model's being used beyond health, and our next speaker is going to talk about how we're starting to use ECHO in education. And it's become a truly global movement. So ECHO uses very simple Zoom video conference technology to connect the hub team with the spoke participants. It's highly collaborative, it's non-hierarchical, and it's based on the principle of all teach and all learn. The experts at the hub contribute specialist content expertise, but the participants at the spokes contribute their knowledge of local context and cultural considerations and, you know, what will and won't work in their community. And everybody learns from each other. So I like to think of the hub as the content experts and the spokes as the context experts. So in Queensland, we've just one dedicated tertiary paediatric hospital, the Queensland Children's Hospital in Brisbane. But Queensland, as I'm sure you know, is huge, and some of our specialty teams, for instance, our paediatric palliative care service, provide the one and only service for the whole state. So if you're a child living in Cape York, for instance, we're over 2,500 kilometres away. But our organisational aim is that every child in the state can access high quality care as close to home as possible. And so ECHO is one of the ways we're really trying to achieve that by supporting local practitioners. Oops. Oh. There we go. So we're applying the ECHO model in multiple ways to improve accessibility of care for kids and young people in the state, particularly, as I said, those in underserved at-risk populations. These are the ECHO series we offer, and they range from those focused on really common challenging conditions such as ADHD and behavioural and mental health problems, where our target audience is largely GPs, but also nurses, psychologists, teachers, guidance officers and so forth, right through to quite niche series such as the one on congenital foot anomalies, which is targeted mainly at regional and rural physiotherapists. Each series aims to address a different gap in care for a particular population of children, and you might notice that many of these conditions that we're targeting through ECHO happen to have a higher prevalence in rural and remote regions, and that really unfortunate combination of a higher prevalence but fewer treatment options in those areas makes a modality like ECHO all the more important. At CHQ, we're also intentionally using ECHO beyond the health sector to support teachers and guidance officers working in schools and other education settings. And the Refugee Kids series that you can see, the second from the bottom, is a really good example of this. So the idea behind that series is to support the staff who are supporting the kids. And in particular, in this case, helping the education staff to understand challenging behaviour in refugee background kids from a trauma-informed perspective, rather than looking immediately for a diagnosis such as ADHD or ASD, for instance. The commonality amongst all these series is that through ECHO we're supporting professionals from a range of backgrounds and geographical settings, and we're linking them using simple video conference technology to our expert teams in Brisbane. So thinking about what we're doing at a strategic level, we're leveraging our organisation's collective knowledge for maximum benefit at a population level. We're using ECHO to integrate primary, secondary and tertiary care, to integrate mental health and physical health, and now, really excitingly, as I said, to drive cross-sector integration. ECHO is a truly global movement, and we're certainly not the only ECHO hub in Australia. Liverpool Hospital has had a long-standing hepatitis C ECHO, focusing on supporting GPs to manage patients in the Western Sydney catchment without need for referral to the liver clinic. In Victoria, here you have the Victorian Opioid Management ECHO, run by the Department of Addiction Medicine at St Vinny's. It's got a really strong rural and remote focus, and more than 70% of its participants come from outside Melbourne. And in New Zealand, Hospice Waikato is the first hub to launch with a community palliative care series. But currently our hub's the largest, and earlier this year my team trained to become this thing called a Superhub. So a Superhub is essentially a large ECHO hub accredited to train other organisations. ECHO, as I think I mentioned, was founded in New Mexico in the US, and the story of its growth is a presentation in and of itself. But in short, to use the ECHO model, you need to be trained by one of the University of New Mexico's Superhub partners. And we're one of those. There are just 13 globally, and we're the only one in our part of the world. So we delivered our first training as a Superhub just a few months ago to organisations including Apunapima, which is the community-controlled Aboriginal health organisation serving 11 Cape York communities, Western Victoria PHN, and Health Consumers Queensland. And I was super excited that one of the organisations we trained was the Royal Australian College of General Practitioners. In March next year, the RACGP is going to implement ECHO nationally as part of their alcohol and other drugs program, and they'll have multiple hubs in different states. The expert panels in that case are going to be made up of GP experts, addiction specialists, nurse practitioners, pain specialists, psychiatrists, pharmacists, Aboriginal and Torres Strait Islander health workers, and patient representatives, and I think it sounds really exciting. So please consider becoming part of the ECHO and train to become a licensed replication partner. Start an ECHO hub to reduce disparities in your communities. The model's free, and as a replication partner you get free access to the software that sits behind the model, the iECHO software. You get a free licence to use Zoom, and you get ongoing support for your implementation of your ECHO hub. The training, it's a 2-day training. The training that's provided is around fidelity to the model, not the clinical content. So although we're a paediatric hospital and health service, as you can see, we've trained adult organisations. And that's really just to ensure that an ECHO in Brisbane or Melbourne looks like an ECHO in Chicago, which looks like an ECHO in Albuquerque. So as a replication partner, you'll join the ECHO Asia Pacific Collaborative, which we've started, and you'll get access to the global Meta ECHO community, it's called, which encourages international collaboration around research as well as sharing of all resources. So it really is, the idea behind it is to democratise medical knowledge, but ECHO is really about democratising the knowledge it has as well. So that sharing of resources is very important. So our next training for ECHO is in February 2020. So please get in touch with me if you're considering joining the movement. Thank you very much.
Thank you, Dana. Dana, would you like to stay for a moment? Are there any questions of Dana? I'll come down with the mic this time. Oh, you've got one? Thank you.
Thanks. Hello? Yep. What are the advantages of having the multiple ECHO hubs? Is it that they do different content?
I think, well, I didn't talk about the number of participants, but really the sweet spot is about 25 participants. So really what we're trying to do in ECHO is develop a community of practice where everybody gets to know each other quite well. And although the Zoom software can accommodate 99 participants, we're really looking at 25. So for really common conditions like behavioural and mental health problems, we need ECHO hubs everywhere. We need multiple in every state. But for congenital foot anomalies, for instance, I think we just need one national series. That will really cover it. And that would probably cover the Pacific Islands as well. So it really just depends on the topic that you're interested in.
So people can participate from anywhere,
yep.
but the suite number is about 25 participants?
Yep.
Okay.
Any other questions? In the second row.
Thank you. Thank you so much for your presentation. My name is Oksana Zelenko. I'm from Queensland as well, QUT. I'm a design researcher. I'm really interested in this multiplication of the different hubs and whether, because I like the distinction between content expertise and context as patients as experts of their lives and so on. But I'm wondering, has context ever impacted on the design of the features of the hub that might in its offer of communication modes differ from location to location? Just from the system design's perspective, just curiosity.
Sort of. So we received a small grant to use ECHO to improve Indigenous health outcomes, and because you can Zoom in from anywhere, we thought that we'd provide the content expertise from Brisbane for communities in the Cape, and they actually wanted to do it themselves. So they wanted, their context, so they want to be their own hub, which is completely fair enough. And so, we're really excited that they trained with us in August. So yes, sort of.
Thank you.
Any other questions for Dana? Dana, I've got one question for you. What has been the biggest challenge establishing and rolling out ECHO?
There are so many. I think, at the moment, the biggest challenge is sustainability, financial sustainability. It's an incredibly cheap model, but it's not free and it's not frontline service delivery. So I would say for us, that sustainability is one of our biggest challenges. There are lots of others. Shall I give you another one?
Yeah, give me another example.
Another is that not all specialists want to share their expertise, thanks very much. So, you really need to pick the people that you work with, and they need to be people that believe in sharing their knowledge with community providers. So that's another really interesting one.
You're off the hook.
Thanks, Frank.
Thank you. Can you please join me in thanking Dana for her presentation?